The report, titled The Urgency of Now, AIDS at a Crossroads, highlights both progress and challenges in the fight against HIV and AIDS in the region. According to the report, the Caribbean has made significant strides in HIV treatment and prevention since 2010. However, the pace of progress has slowed in recent years, particularly in reducing new infections. According to Janelle Benjamin, Program Coordinator for the National Infectious Disease Control Unit in the Ministry of Health, said a lack of education surrounding healthy sexual practices and a lack of political will poses the biggest challenges.
Throughout the entire region, and the pace at which we are slowing down with regards to meeting our targets for ending AIDS by 2030 is the lack of political will. Right? It's the lack of political involvement. And it's primarily not that, and I don't want to, it's primarily not because they are not interested, but there is a possibility that there are other priority areas that may have taken the forefront. Right now, in Grenada, if I can hone into in the Grenada context, that is somewhat what we're experiencing. Now, within the Ministry of Health, there is that level of support that we get, right? However, Ministry of Health is going to also have challenges when trying to extend our reach.
The UNAIDS report highlighted 4 countries, Cuba, the Dominican Republic, Haiti, and Jamaica, accounting for nearly 90% of new HIV infections in the region, with Haiti alone responsible for 38% of new cases. Benjamin said records show the prevalence of the disease mostly among young people. She added that for the past 6 to 7 years, we have maintained our numbers between 20 and 25. However, last year was one of the highest they've had during the period, 29 new cases, with men being the highest of the 2 genders.
So our age range for new infections has always been and remains between the age of 20 to 45. At some point, a few 5-6 years ago, we were at 25. Now we have gone down to 20. That is slightly alarming because it means that our younger population is now becoming exposed at a higher rate. All right. It means that more and more of our young youthful population are not just engaging in sexual practices, but engaging in unsafe sexual practices, and they are not they're more so engaging in these practices without the knowledge or the understanding about protection and HIV STI education.
While treatment coverage has expanded in the Caribbean, with 70% of people living with HIV now on treatment, significant challenges remain. Late diagnosis and difficulties in enrolling and retaining people in care continue to hinder progress.
So our numbers thus far from 1984 to now, we have had 785 persons registered with HIV. All right. However, out of that 785, we have to minus our deaths, and our AIDS deaths were 319. We have been maintaining our stocks and maintaining our access to care as best as possible. Right. In terms of treatment, we have maintained the level of increased quality of drugs that helps with the reduction of reducing our viral loads and maintaining CD4 counts within our clientele. We have maintained that. We are still good. We maintain the WHO standards, and we ensure that our clients are provided with the best care.
The Urgency of Now report presents a critical juncture for the Caribbean's HIV response. It suggests that with sufficient resources, sustainable funding, and a commitment to protecting human rights, the region can make significant progress towards ending AIDS as a public health threat by 2030. However, failure to take bold action now could result in a reversal of hard-won gains and an increase in the number of people requiring lifelong HIV treatment. Christina John, GBN News.